Hello everyone, welcome to another video. I hope you enjoyed our headache series where we covered migraines, tension type headaches and cluster headaches. So today we'll be looking at something different. We're looking at a condition known as otalgia. So otalgia simply means ear pain. So it's pain in the ear, and it can come from a problem within the ear itself. And when it comes from a problem within the ear itself, is known as primary otalgia. Or it can be like transferred pain from another nearby area like the throat, the teeth, the jaw, or the neck, because like all these areas are connected. So it can be a transferred pain, and when it's a transferred pain from another organ, this is known as secondary otalgia. So otalgia, it can affect one ear or both ears, and the cause determines if it feels dull, if it feels sharp, throbbing, or if the pain will be like burning. So otalgia is common in all age groups, especially children, and it can range from like mild discomfort to severe stabbing pain. While like ear infections are a well-known cause of otalgia, many other issues can lead to like ear pain. So looking at the anatomy and the physiology, to understand ear pain, we have to let's break down like the parts of the ear into three parts. So there's the outer ear, which includes like the ear canal and the external ear known as the pinna. Then there's the middle ear, which is like the air-filled space behind the eardrum, which contains the ossicles. That is like tiny bones. Then we have the inner ear, which is involved in balance and hearing, and it rarely causes ear pain. So several nerves supply the ear area, like for example the trigeminal nerve, the facial nerve, the glossopharyngeal nerve, the vagus nerve, and the upper cervical nerve. And this shared nerve supply explains why pain from the teeth, the tonsils, or the neck can be felt in the ear. So that's what I mean by like all these areas are connected because they share like the same nerves. So the types of otalgia, we have primary otalgia, the pain that originates from the ear itself. Then we have secondary otalgia, which is referred pain or transferred pain that is felt in the ear but comes from another site. So what exactly causes primary otalgia, whereby the pain comes from the ear itself? So we have different causes. For example, we have something called otitis externa, and it's basically infection of the outer ear canal, also known as swimmer's ear, and it's usually painful, especially when pulling the ear. So we also have otitis media, and is a middle ear infection which is often found in children. We actually did a video on otitis media. So it is an ear infection that is also found in children, and it may come with fever, hearing loss, or irritability. Then we also have another cause of primary otalgia besides otitis externa or otitis media. We have presence of foreign body. So it's common in kids where there's a foreign body in the ear, and it often leads to pain, blockage, and even infection. Then earwax impaction too. So hard impacted earwax can cause pressure pain. And then we also have barotrauma, which is like due to pressure changes during flights, which affects the middle ear. Then we have tympanic membrane rupture. So the eardrum tear due to trauma or infection. So sudden pain may like follow the rupture. So we also have something called mastoiditis. So it's an infection of the mastoid bone, like behind the ear, which is rare but is a serious infection. So it can also cause otalgia. Then trauma like trauma, like if an object hits the ear, or if somebody gets slapped if somebody gets slapped on the ear. So all these things can cause like primary otalgia. So looking at secondary otalgia, whereby other is like pain, is like the cause is from another site, not generally the ear itself, from another site, then it's transferred to the ear. So for example, dental issues, like having issues with your teeth, like cavities, abscesses. So the pain usually radiates to the ear. Then throat infections like tonsillitis, pharyngitis, or the itis, peritonsillar abscess. So all these things, they can transfer to the ear, like the pain. Then we also have cervical spine issues. So nerve compression in the neck can radiate to the ear. Then there's also another condition known as temporomandibular joint dysfunction, which is like pain near the jaw joint that worsens while chewing. So this pain can be felt in the ear too. And some tumors too, especially in the throat or in the base of the tongue or the nasopharynx, especially seen in older adults or smokers. So all these things are usually causes of secondary otalgia. So looking at the signs and symptoms, so the signs and symptoms depends on the cause, but they may include number one, like earache, can be dull, sharp, or throbbing. Then fullness or pressure in the ear, hearing loss, discharge from the ear, having pus or fluid coming out from the ear. Then fever, especially when the ear pain is caused by an infection. Then pain on chewing or yawning. Then tenderness behind the ear, which suggests mastoiditis, which is very rare. Then sore throat or tooth pain, which suggests like a referred pain that is coming, like the cause is coming from the throat. So looking at the differential diagnosis, so other conditions that could occur whereby we would have like this otalgia. So otitis media, otitis externa, dental abscess. So we basically talked about this already. So all these conditions, they come with ear pain. So looking at the pathophysiology, primary otalgia, infections or trauma directly stimulates the nociceptors, that is the pain sensors in the ear structures. Then with secondary otalgia, is due to shared nerve supply. So pain signals from the nearby organs are misinterpreted by the brain as like coming from the ear. So for example, a tooth infection like sends pain through the trigeminal nerve, which also supplies the ear area. So the brain may register it as like pain coming from the ear. So that is about the pathophysiology. So looking at the treatment, so for primary otalgia that originates from the ear itself, like when it's primary otalgia comes from like otitis externa, so we could give topical antibiotics or sterile ear drops containing ciprofloxacin and dexamethasone. Then for cases of otitis media, we could give amoxicillin with clavulanic acid, and we could also give NSAIDs or paracetamol for pain. Then earwax impaction, we could give hydrogen peroxide drops or olive oil. Then for if there's presence of foreign body in the ear, it usually requires like removal in the clinic. So it may require an ear, nose and throat doctor if the foreign body is usually deep inside the ear. Then we'll have barotrauma. So for barotrauma, we could give decongestants, nasal sprays. Then for tympanic rupture, is often self-healing, and it's best to also avoid water entering the ear this whenever this happens. And if this if it comes with an infection, so antibiotics can be given too. Then for secondary otalgia, so we usually treat the underlying source, like what exactly is what exactly is causing the pain that is being transferred to the ear. So for dental issues, so it's better to give like antibiotics, or like visit a dentist for like extraction of that particular tooth if it requires an extraction. Then for throat infection, we give antibiotics, lozenges, fluids. We encourage them like taking fluids and all that. And for tumors, see an ear, nose and throat doctor, and like they'll get a biopsy and everything. So for the management, it's better to like take a good history to identify whether it is a primary or a secondary cause, and inspect the ear if inspect the ear doing otoscopy if it's possible. So, and also it's good to refer to a ear, nose and throat doctor if there is no visible ear cause, but there's like a pain, a persistent pain, and there's suspect, like if there's suspected malignancy, or there's severe trauma to the ear, or this foreign body can't be removed easily, like it's very deep inside the ear. So usually not all ear pain comes from the ear, and sometimes it can be your teeth, it can be your jaw, it can be your neck causing the pain. So it's better not to self-medicate with ear drops until you know the exact cause. Like, it's not all the time that okay, your ear is paining, you go and put ear drops. Sometimes you're actually not even helping the issue. So it's better to like go to a pharmacy or go to a hospital, get like explain to the doctor the issue, so that you can get your history and they can try to know the exact cause and treat the exact cause of the problem, not the symptom. So it's better to, because if you are just treating the symptom and there's something causing, like you are just treating the symptom, you're not targeting the exact cause, you just keep having like a reoccurrence of this issue. So it's better to treat the cause and not just the symptom. So that is basically it for this topic known as otalgia. So thank you for watching this video. See you in the next video. Bye.